Good morning, Miss Doe. I'm Kiera and I'll be your nurse today. You'll be receiving the Mohs surgery, which is the most effective treatment for removing basal cell carcinoma while preserving the healthy tissue. Basal cell carcinoma, known as BCC, is an abnormal growth or lesion that appears on the deepest layer of the epidermis or the outermost layer of the skin in the basal cells. BCC will appear to look like an open sore or red patch. They tend to be caused by intense and repetitive exposure to the sun. The doctor performing your surgery today will be Dr. John Doe. He's a dermatologist trained in Mohs surgery and pathology. He will begin making marks around the lesion with a marker to map where the tumor is located. He will then inject you with local anesthesia and begin using a scalpel to remove the layer of visible cancerous tissue. I, your nurse, will then bandage your wounds and walk you back to the waiting room. He will then review the tissue under a microscope in our on-site laboratory to look for the presence of cancerous cells. If they are still visible on the tissue, he will then bring you back into the operating room to repeat the process until there is no signs of the tumor. Once cancer-free, Dr. John Doe will begin stitching the wound closed and bandaging it. This surgery could take hours depending on how much cancer cells are present in the tissue. Due to the size and depth of the tumor, you may be more at risk for permanent cicatrice, also called scarring. Here is a set of instructions on how to properly care for the wound and to minimize severe scarring. If you see any signs of erythema, known as redness, and edema, known as swelling, please contact us immediately. I want to schedule for a follow-up appointment to remove the stitches within the next couple weeks. Dr. John Doe is available from Mondays through Wednesdays from 8 a.m. to 5 p.m. Which day works best for you? Tuesday, July 12th at 10 a.m.? Perfect! We will see you back here on the 12th of July at 10 a.m. Have a nice day, Ms. Doe.